In our third lesson, we are going to discuss the eyes. What determines the size and how to make them naturally bigger. Now let's talk about the eyes. The eyes can be closed or wide set. This depends on their position and on the shape of the face in general too. This feature can be understood only in comparison. For example, Oleg Menshikov's eyes or Darya Dantsova's eyes are close set. I speak mostly about the position of eye sockets on the skull, and consequently about how the eyeballs are set, far or close to each other. On the contrary, Liza Boyarskaya's or Leonid Parfenov's eyes are wide set. And there is another factor which makes the eyes bigger. And if the eyes are bigger on their own, they seem wide set. So, this is the amount of muscles and fat tissue. So, what impacts the shape of eyes? At first, it is the shape of the skull and eye sockets. These muscles, small muscles, are called oculomotor, relating to or causing eye movements. They allow rolling our eyes. So look at them in section. And this is orbital underskin fat tissue in the area. So a typical person has a fat layer here. But if he or she become thin, the eyes become sunken and seem smaller, even if the orbicular muscles of eyes are well developed. It means big and thick. Vice versa, a thick layer of fat tissue in this area of a heavyweight person can visually suppress the eyes. So, if a face is fat, the eyes seem smaller. This is the lacrimal gland. Now let's study the orbicularis oculi muscles of the eyes. Let's have a look at these photos. Please pay attention to these lines. Because this is the area of procerus muscle. This muscle. The orbicularis oculi muscle goes outside the eye socket, including the area of brows. So, there, this line, that line is the lower edge of the orbicularis oculi. It can be clearly seen on these faces. And also, this is a palpebral part of orbicularis oculi muscle. That part. It shapes the eyelids. And you know, it's obvious at these photos it's clearly drawn by eyelid folds. So these lines. So it arises from the medial palpebral ligament and is attached to the lateral palpebral ligament. And it works when we blink spontaneously, because an awake human constantly blinks to wet the eyeballs. And this part is called orbital. This is the largest and extends onto the face some distance beyond the orbital rim. It arises from the nasal part of the frontal bone, goes around the orbit in a concentric loop, and is attached to the frontal process of maxilla. Additionally, it's attached to the medial palpebral ligament too. This part works when we deliberately tied up our eyes. And well, actually, the palpebral part is involved in it as well. The perceivable size of the eye depends mostly on the size of the orbicular muscle. The greater are these muscles, the greater are the eyes. And even if the eyes are close set on the skull, which means that the distance between eye sockets is small, but the orbicularis oculi muscles are big and well developed, the eyes will be big. For example, the eye sockets of Amanda Seyfried's eyes, or skull are wide set, and so also her orbicular oculi muscles are well developed, very big, which makes her eyes more prominent and perceivably greater. Anne Hathaway's eyes are set normally on the skull, not wide, not close, but her orbicularis oculi muscles are very big, which makes the eyes rather big than normal. And another example is Shia LaBeouf, whose eyes and orbicular muscles are fairly normal, so his eyes look usual, but rather big than small. Brad Pitt's eyes are set normally, and his eye muscles are big, but his mouth, jaw, and masseter are so big that the lower part of the face visually overshadows the upper part, and the eyes seem smaller. However, it is considered to be okay for a brutal male. As you already understand, even normally set big eyes might seem less only because the soft tissues of the temporal region, masseter, cheeks, or other parts of the face are big, or because a person is fat and there is a great amount of fat tissue in this area, or because a person is fat and there is a great amount of fat tissue in this area. And through this, the eyes are overshadowed by other volumes and seem less. I remind how the subskin fat tissue is distributed, which is clearly seen at these pictures. Also, the best way to increase your eyes is to do the exercise training, the orbicular muscle of the eye. You should contract them, close your eyes tight. I'll tell in more details about how to do it properly in the next videos of my course dedicated to the exercises and my methods of training of the facial muscles. But now, please watch the next video of our facial anatomy series to learn what forms the lips and why they look so unnatural after collagen injections.